Few years ago, there was a study from the Lancet that said that there were about 10 or 12 million additional deaths per year resulting from pollution. There's a recent study that I have with me, and I can share that with you, put in the link, about 1.5 million deaths per year coming purely attributable to the pollution effect. Now, I will go little deeper into this, if I may, and tell what happens to the effect of pollution from childhood. So we know that there are studies that have shown that if a mother smokes during pregnancy, and that's why we don't let that happen, the child can develop asthma and COPD.
Yes.
Because the pollutants go through the placenta into the baby's developing lung, and the damage is pretty bad. We now feel that that similar thing will be happening with air pollution. Now I'll share with you two studies that I have been, part of. I mean, I have conducted those studies in Mumbai. So what we did 10 years ago, and that's exactly the same study I repeated last year, we did lung function testing of all the nurses in one of our hospitals. Okay, in Jew, so it's a very select group. All these girls are young; they're in the 20 to 40 range. So it's not that they've had years of exposure to. They're all in a non-polluted area. So they're not living in Sion or, they're not living in Delhi. They're living in Juhu. We believe that would be one of the cleanest parts of Mumbai. It's right next to the sea. None of them is using biomass fuel. None of them is in an industry that is full of pollution. For example, they're not working in mines. They're not working in factories of cotton. So technically, the best lungs, non-smoker, they're yet young. There's nothing that has hurt their lungs so far. Not age has not had its effect. Nothing is had effect. They should have normal lungs. So 10 years ago, we found that about 25% of these girls had lungs that worked less than 30% from the normal.
Okay.
So that means, and now coming 10 years later, 1/3 of the girls had lungs that worked 1/3 less. Now, if I was to say 1/3 of the Indian population had an ejection fraction of the heart that was only 40 and are going into heart failure, they would be panic.
But somehow, pollution doesn't scare people in the same way. Why not? We're going through this winter right now with rising pollution numbers across most of our cities, but everybody's just willing to live with it.
So my experience as a doctor is when I tell patients that, so you have an allergy, and that you're having difficulty because you're chronically coughing, and they would say, "Tell me, what can't I eat?" I said, "Food has nothing to do with it." Then what has? And I tell them, it's the air that you breathe. Oh, that's fine. I say, it's not fine. But what can we do about it? So I think there's a feeling of resignation that this is something I cannot do anything about. I have to breathe tomorrow morning. So I mean, I have to breathe all the time. But so there's a deep sense of resignation, failure to do anything about it. And it's just a despondency, I think.
So, what you're saying to me effectively is that when there is air pollution, not only does it put us all on the risk of getting cancer as if we were smokers, our children effectively will have underdeveloped lungs.
Yes. And that's very well recognized.
So all the children we are raising in cities with air pollution will have underdeveloped lungs.
It's a very high risk. And I told you my study with these young girls, at the age of 20, 25, they're 1/3 lung capacity less. 50% of them had of number which shows air breathing in, bronchitis kind of
Yes.
thing. 50% of them had something to suggest bronchitis.